Welcome to Patients at Risk, a discussion of the dangers that patients face when physicians are replaced with non-physician practitioners. I'm your host and the co-author of the book, Patients at Risk, The Rise of the Nurse Practitioner and Physician Assistant in Healthcare, Dr. Rebecca Bernard. One of the main reasons given for the expansion of non-physician practitioners is a lack of access to physicians. A huge factor causing a physician shortage is a shortfall in the number of residency positions. And in fact, this year, an aspiring 7,000 physicians will be unable to continue towards medical licensure because they failed to obtain a residency position. But another contributor that we don't always hear about is the number of physicians that are leaving the workforce. Doctors are increasingly burned out and depressed about the state of healthcare, and many experienced clinicians are seeking a way out of the practice of medicine, choosing to retire early or change to a non-clinical role. So today, we're going to discuss a really important cause of this physician despair, an often toxic work environment experienced by physicians across the country. And there's no one better to address this issue than my guest today, Dr. Doug Farrago. Doug has been fighting to improve the state of medicine for decades. In his most recent book, The Hospital Guide to Physician Retention, is focused on improving the work environment for physicians. Dr. Farrago, welcome to the show.
I appreciate it. I'm a big fan of yours. I love your book. It's around here somewhere. I reference your book in my book. And so, yeah, obviously we're of the same mind.
Now, you've been an inspiration not only to me, but to so many other physicians. You've been a pioneer in the direct primary care practice space. You're an inventor. You've been a magazine publisher. You're the author now of multiple books. The list just goes on and on. So start us out by just sharing a little bit about yourself and how you got to this position.
I've been a family doctor at heart, and I for the first 15 years, I was employed by two different hospitals. And so I know that world really well. And I realized that I could not exist in that world. That's my personality and the way medicine was going. And that's before the crap of what we're seeing of replacements and quality metrics and other things that are horrific, right? And so to save my career in life, I did direct primary care, and I exited in, I think it's 2014. And I wrote 3 books on direct primary care because I think that's the savior of primary care, and personally for me and for specialty care as well. But I always felt that, I left people behind. Most of us, actually. You got to think there's not that many of us doing direct care. So I felt like there has to be something, because we're seeing this massive burnout, the great resignation. And so there's got to be something we can do to help them. But you and I know who do direct primary care, we can fix the system on burnout pretty easily. We get rid of insurance companies, we get rid of billing, we have a membership model, and you have more time, you enjoy your life, you enjoy medicine again. Now, unfortunately, that's a slow movement, but that is the easy fix. Since we can't do that for the people who are stuck, I wanted to write about the things that we can do. And there are some things that can be done. And the question is, do the CEOs and administrators want to do it?
What you're saying is so right, in the sense that I believe direct primary care, or direct care, which because specialists can do it too, is absolutely the answer for our broken healthcare system. But I understand that there are some physicians who really are tied to a hospital system. Our surgical colleagues are, of course, hospitalists, ER doctors. They might have a few options here and there, but overwhelmingly, it's really hospital based. So that's one of the things that I love so much about your book. The idea behind it is to try to encourage and inspire healthcare administrators to understand better what they need to do to keep physicians, retain them, to make sure that they're happy so that they can provide great care to patients, which is really what it's all about. So you wrote this book actually for administrators, and tell us a little bit about why you realized that that was the approach you wanted to take.
The truth is, I want to help my physician colleagues in the system, right? And happy doctors stay, happy doctors make happy patients, happy doctors recruit other happy doctors. And so that's all good. And then the other end is you save them so much money. So the recent numbers I put in my book, $250,000 to $300,000, maybe $500,000 to replace a doctor. Now the number's up to $1 million. So you got to think, well, if I'm a person in administration, I may want to not care about my ego so much. I want to do what it takes to take one doctor. So my $25 book could save you $1 million. And that should convince them enough to be buying this book and they're not.
Yeah. I mean, it makes perfect sense. And in fact, I was shocked in my first job. You know, you talk about in the book how hospitals and clinics spend a lot of money to recruit physicians. They
Yes.
wine and dine you. They tell you so many wonderful things. And then as soon as you sign on the dotted line and you walk in the door, all of a sudden you're almost treated like garbage, like you're totally dispensable. And it's shocking. And I don't understand the psychology of it. Maybe we need to bring on a psychiatrist to help us with that.
It makes no sense, right? So the cover of my book, as well as if you go to physicianretention.com, it's a bucket filled with a hospital symbol on it, being filled with water with holes coming out of it. All the water's coming back out. It makes no sense to keep filling the freaking bucket up if you don't patch the holes, okay? In fact, I was going to call the book Plug Your Holes, okay? Because the bottom line, if you don't plug your holes, you're losing money. Now, what you said is exactly right. They wine and dine you, spend all this money to recruit you, and then they forget about, oh, maybe the first few months is a kind of grace period, but then they just devalue by not even knowing you. I mean, I remember going from one hospital to another in Maine, and it was a big coup for that second hospital to get our group of 3 doctors to come over, and we did, and they had a big open house party. The CEO was there hugging us, and within 6 months, I went to a restaurant at noon, and the CEO was sitting right next to me and didn't recognize me and did acknowledge me. Now, does that leave a mark? It does. These are the simple things I put in the book. Know who your doctors are. At least recognize them. Hey, Dr. Doug, how's things going over there? That little bit means a lot. And you know what? That may stop one doctor from leaving. Now, there's a million other things you can do, I put in the book, but the bottom line is they're ignoring this at their own peril. And I'm giving them not all the answers, because there is no all the answers, but I'm giving them from the doctor's perspective what it could take to keep them. And you would think they would eat that up, except when I sent advanced copies out, many were pissed to the point where I just laughed and wrote on my book, on the emblem on the cover, I wrote, 9 out of 10 administrators hate this book. And it blows me away, but it is a reality. They hate it.
Yeah, that was one of the most interesting parts of your book, which is just the first chapter, the preface, actually, where you talk about how angry and irate, and to the point where you're like jokingly saying, like, maybe I need to get some therapy here, because people just are outraged that you would have the audacity to tell them what you think they should do as a physician with all this experience. They are just infuriated by it. So what are your thoughts on why that's happening?
So every other industry, tech, especially big tech, everybody actually are doing what they can to retain employees. They're doing things like wine bars and parties and ping pong tables and video, whatever they can do to retain these employees who are well-trained and worth a lot to keep a coder. A doctor's $1 million loss. You should think these administrators would eat this up. But there's ego involved. And I don't know where this happened. And maybe because doctors have egos too, right? We've been through a lot. We don't love being told by administrators how to do patients. And so there's a battle going on there. And so if people don't release their ego, especially administrators, they're going to lose in this. But these people who read my advanced copies were angry that I mentioned things like, maybe you should think about acknowledging Doctor's Day. Maybe you should think about a doctor's lounge, a physician liaison, all these things, whatever it takes, get your ego out of it and save $1 million. Why? That's for one doctor. Why wouldn't you do it for all your, it's amazing. And so when I first started, I remember at a residency, I was recruited by 2 past residents. The initial administration treated us well. They had a physician liaison. They had this, I remember calling my, an intern who was my friend. And there's biscotti and nice coffee in this doctor's lounge. And that biscotti eventually led to him coming, and then another one coming. And then he got 2 of we had 10 doctors recruited because of biscotti. Okay. I mean, that's simplified, but you know what I'm saying? Those little things, and they lost their way, got rid of the lounge, got rid of the liaison and doctors, and did little things that doctors started leading. But you can do it. You can see how it can domino effect the right way, or it can domino effect the wrong way. And I can't understand why they don't. Now, it could be their ego. It could be there's contempt for doctors. It could be they're thinking, oh, these doctors need more resilience in their burnout. It's a doctor issue. It's not our issue. It's every excuse you want to make. You know, I point out there's good doctors and bad doctors. I point out that doctors can be ridiculous egos that I can't, about 15% in my estimation, I can't stand. So it's not that anybody's evil or perfect or either way. I'm just trying to say, hey, here's some things you can do And why don't you do them? Because I think you may save yourself a lot of money. And yet they still had anger for me to do for writing it.
Let's hope that we are targeting those administrators out there, or physicians that are administrators, or physicians that know administrators that they think would benefit from this book. And let's talk to them about why they should read this book, because it really is outstanding. You go through and you outline the problem, which you and I could go on and on and on about because we understand that problem. But let's focus right now on solutions and some of the things that you have recommended. Say that the very first thing that these organizations should do is actually analyze their situation. And you talk about something I'd never heard of, which was a net promoter score. Explain a little bit about what that is.
The easiest way to see if your hospital is doing a good job is not physician retention rate, because we don't know how to calculate that. Every hospital lies about their retention rate. Oh, our turnover is a certain percentage. They're lying, everyone. I put this in the book, but urgent care center, they said, oh, our retention rate's like 6.9%. I'm like, this center has had 80 doctors in a year come through, 80. The
same thing happened in a company I worked for, a federally qualified health center, and we just watched doctors leave and leave and leave. And I said, well, when I complained about a lot of the problems, they said, well, what are you talking about? I said, but look at all these doctors leaving. And they said, oh no, this doctor left because their wife didn't like it here. This doctor left because, and of course they were completely wrong. That was not why they had left. They were left because they were very discontented with the situation. But like you said, they don't really have a good understanding of why people are leaving.
They don't want to know the number. They'll lie about the number. The doctor will lie why they're leaving because they don't want to burn bridges, right? And because so there's a lot of reasons why retention rates are useless. So you go back to what's called the Net Promoter Score, which is by Reichhold, who started this book. He wrote a book in 2006. If you ask doctors, and you got to ask them all, would you recommend this hospital to a colleague or friend to work for? And if they rate, it's from 1 to 10. And now, so here's the first thing. Doctors hate answering surveys where we know it's crap and we just blow them off. You just say, listen, this is a one question from 1 to 10, you're done. So 1 through 10. And if you have the highest ones who recommend it and you subtract the lowest ones who don't recommend it, but you can see who's positive and who's negative. Now, most tech companies that do so much for their employees, they're like positive 50. Most hospital systems are net in the negative 20, negative 30, negative 40. Mostly people are detractors or hate the place than not. And so the only physicians that Reichhold found, physician groups who are run by physicians, they're in the slightly positive range. So I challenge any hospital who claims they have low turnover rate, doctors love it here, and maybe they do, but you don't know. You don't know unless you ask that question. And why do you want to ask that question? Well, then if it's not a good score, then you need to hire somebody to come in and figure out why it's not a good score and what you can do to fix it. And all that work could save you one doctor from leaving. And that one doctor has just saved you $1 million. It's a very simple thing.
Now, I want to go back to what you said about the surveys, because I used to get a survey every year about what can they do better. And the first couple of years when I was young and naive, I would write a book about all the things that they could do. And then I started learning after a few years, whatever happens to those surveys that I spent all that time on, they just get circular filed. So after a while, you just say, there's no point. In fact, you start to get angry about it because you're like, why are you asking me this? You're not going to do anything about it. So I like that this is just a one question, which is
anonymous too. It has to be anonymous because doctors now are afraid to speak out, and there's fear out there.
Absolutely.
that you can get fired for saying things. I'm aware because I went through that. I went through all this. I was fired once because they wanted me to sign off on a third-party billing situation that they can optimize my billing. Yet if they did anything wrong, I'm the one that gets sued or go to jail for Medicare. And I'm like, I won't sign that. And they fired me. And then at the last minute pulled that firing back.
I quit a job over a moonlighting job over that very thing. They had some new electronic health record and they just wanted me to check a box that was basically fraud. And they said, oh, well, don't worry about it. It's just, you have to do it to get through this, blah, blah, blah. And I said, oh, no, I won't. And maybe when I was younger, I might have, but having a few years under my belt and realizing that, like you mentioned in the book, that the liability always ends with the physician, no matter what they tell you. After you've asked that initial question or analyzed and determined what your score is, let's say, and you decide that you need an action plan, the next thing that you recommend to administrators is that doctors, and I even say staff in general, need to know that their administration cares about them.
CEOs need to show they care. I mean, the guy who doesn't recognize me doesn't, how hard is it not to recognize? How hard is it to leave a note for a doctor and say, hey, good job with this. I saw you do this. Or there should be a physician's safe space or doctor's lounge. And I'm saying just doctors, not NPs and PAs. They can have their own, but doctors need to be able to talk amongst themselves. And you can't fear that. My past hospital used to fear that. It's like, what? And so when doctors have a sense of community, and they actually know each other, which is getting less and less now, right? Because they're not going, the hospitalists, you don't go in the hospital as much. So maybe that safe space, that hospital lounge is actually migratory and moves around, and you do it at night or something, and they can pay for it, the hospital. So the doctors actually get together and are a community again. That would help a lot. And those, they show that the statistics of people staying because they feel a sense of community, they will stay longer. And that's what you're trying to do. Again, it's about physician retention. These are simple things to do.
I mean, you just think back to your training and you remember spending time in the physician's lounge, talking to your colleagues, prepping for the day. And it did create such a sense of community, and even just, going to medical society meetings. So having your hospital pay for their staff to be members of the medical society, that's another thing that they can do to help build community, which many hospitals are getting out of paying for that. So There's a lot of things that can be done by hospitals to build community. And I think you're so right that that's essential. You also talk about having a physician liaison. Now, is that the same as a physician retention specialist, or is that a different person?
So I would define a consultant as a retention specialist to help you build your program. And then the connection between that program and you is probably a physician liaison who actually is involved in that as well. That's the local person. And we had a physician liaison who was an ex-nurse in the field for 30 years. Her name was Jane. She was wonderful. She's the one that made sure the lounge was stocked. She would get you your white coats if it was dirty and make sure it was clean, or get a new one. And she did the little things. That person doesn't need to be involved in negotiations, doesn't need to be involved in quarrels, doesn't be involved in anything like that. They're just to help anything that the group of doctors need, the simple, small things, the little things that make the difference of you thinking, you know what, this place really cares about me, because they have Jane here to help me care about this place.
I'm getting so nostalgic and almost a little emotional, because I'm thinking of our Jane, and her name was Norma, and it was in our family medicine residency program. And she was like a mother hen that you could go to her. She would help you with whatever you needed. She was just a soft voice or a friendly face. And you knew she was on your side and she cared about you. And my gosh, what a difference a Norma or a Jane makes for physicians. Every hospital should have that person.
Absolutely. And I remember just sitting down and talking to Jane about life and stuff like that, and not worrying about it till we get back to administration, right? So this person is not a position of power as much as just someone to truly be an adjunct, a helper. And that would be, I think, is still extremely important. So I have a chapter about that in the book, the doctor's lounge, and then the doctor's day. I mean, obviously 50% at least don't even recognize it, which is, it bothers me tremendously.
I have a quick story about Doctor's Day at my hospital. It was actually the day I decided to leave the hospital. It was Doctor's Day. We had just been acquired by the largest for-profit health system in the United States, and they took over our hospital. And it was Doctor's Day, and they had given us a lovely breakfast. And instead of the usual Danishes, there was eggs and things like that. So then they got up and they told us what was going to happen, that we had been acquired, and that we would be going to a new electronic health record, and that there would be no data migration, and that the doctors would be responsible for entering in all the data from the old medical record into the new medical record. And of course, these are patients that had, 10 years of data plus, and all of us, our jaws were dropped, and I'm raising my hand like, what? And one of the new administrators said, I don't understand why you guys are acting like this. We gave you a free breakfast.
Yeah.
That was really, they were shocked and aghast that we would be they really didn't expect any kind of pushback. And at that moment, after I left the meeting, I called my friend and I said, okay, I'm looking for a new job because I can't work at a place that is so tone deaf or just so clueless about the doctors that work for them.
Don't question why we're burned out if you're adding bureaucratic drag. Don't say, here's yoga or get more resilience training. That just pisses us off.
And what you've tried to explain in this book, and I thought very well, is that it's in the hospital's best interest to make these really relatively simple changes. And really a lot of it is just about showing empathy and showing respect for people that work for you, which to me is just common sense. And it's the way we all want to treat each other. I want to just highlight some of the other things that I loved in this book. Dr. Stephen Mussey, he's a family physician and he's a cartoonist. And he has cartoons throughout every chapter that just really explain some of the lunacy of what happens in medicine. And the cartoons are really great. But I also really enjoyed, he has a little preface that he wrote. And he said something that really resonated with me because I've experienced this where he said, it was like a hospital talking to the new doctor. Welcome to our medical community. We're so happy to have you here. You're obviously very special, except you aren't. And he goes on to say that, explain why basically you're just dispensable. The first time I learned that I was dispensable was a really sad day for me, but also it was very liberating because I was working at a federally qualified health center. I was very young and naive, and my dream was to work for the underserved. And I thought, I had all these illusions about what was going to happen. And like we mentioned, they were very excited to have me and they told me all these wonderful things. And then when I started, of course, everything went in a very bad way. And I learned that if I just didn't show up the next day or they fired me, that life would go on. Patients would get somehow taken care of. And it was really empowering in the sense that it made me change a little bit of the way that I thought about things. I think doctors were often a little bit much martyrs, people pleasers. I remember going to work like sick as anything and just saying, well, if I don't go, what the world will end. And then having that realization was actually really good in the sense that, yes, I want to do my best. Yes, I want to take care of my patients, but also I need to take care of myself because if I'm gone tomorrow, the world will go on.
And the truth is, we are important, but patients move on very quickly. And I know we're altruistic and somehow, unfortunately, they can take that weakness from us, as people look at us as a weakness because they can kind of like use that against us, and which makes me sad, right? And that happened a lot during COVID, and then even later COVID, we're like, well, you can go back sick with COVID, right? As long as you wear a mask, which is amazing, right? So I think that's really sad, and I think we need to be empowering each other more. Going back to Dr. Mussey, he does a great job with his cartoons. He actually has videos of on YouTube as well where these things come to life, and they're very funny. This is the nicest guy. He's a physician a little older than I am, even more gray hair than I have. He is the nicest guy. And I used to think, listen, I grew up in Long Island and in New York, and I can have this, unfortunately, a New Yorker attitude sometimes. And I was thinking that, you know what? I can see these administrators not liking me sometimes because I can come off with a sharp tongue and I definitely don't take a lot of crap. But Dr. Mussey's a great guy and he feels exactly the way I do. It wasn't me. It turns out, guess what? It wasn't me. It wasn't this, my attitude, which they would say, hey, Farrago, it's your attitude. No, it wasn't. It's whatever they can do sometimes to control you. Is what they will do, and they'll use against you. It's me and his attitude. It's you and you're not altruistic enough, and they know how to press those buttons. And that's stupid. That's not proper management. The proper management is what we want you to stay. We value you. We want you to have a meaningful career here and feel good about what you're doing. How are we going to make that happen? And that's not what I'm seeing. Okay.
And, the other thing is sort of a societal issue as well. One of the things that Dr. Mussey says is that, in his joking about welcome and, you're expendable, your patients will respect you and value you so long as you participate in their insurance. And that really made me stop because recently I was reading a Facebook post by a private practice doctor, and she shared a letter that a patient had written where the patient was talking about how wonderful the doctor was. She's the first person that ever listened to the patient. She made the correct diagnosis of celiac disease, which can be hard to diagnose. She got her on the right treatment plan. The patient was improving, but because of a snafu with the billing and the insurance, the patient was firing the doctor. I mean, and it was over like something like a $20 copay. Like, what a crazy disconnect that is.
people don't get that as physicians. It's hard on us emotionally, right? And we have to get a little thicker skin to reverse what you and I do with direct primary care. And I did retire in the last 15 months. But, I remember a patient who I, had no insurance, and I diagnosed with melanoma that no one ever saw before, got them to get it done. Yes. And they got to go on chemo. Now they got insurance, boom, fired me in a second. Okay. Unfortunately or fortunately, you can go back to house of God it's the patient who was the one with the disease. You got to move on, and you can have connections with them, but you got to move on. But it's very hard on us. That adds to some of that burnout you just talked about. And if no one understands that, that's why you need someone to walk in our shoes and understand how that can be.
100%. And just in the last couple of minutes, you shared a story by Louis C.K. It was a comic anecdote. And it was so appropriate. I thought I'm just going to read it if I could.
Yeah.
Everything is amazing right now, but yet nobody's happy. Like in my lifetime, the changes in the world have been incredible. Flying is the worst because people come back from flights and they tell you a horror story. Like, oh my God, it was like the worst day of my life. We didn't board for 20 minutes. And then we got on the plane and we had to sit on the runway. Oh, really? Well, then what happened next? Did you fly through the air incredibly like a bird? Did you partake in the miracle of human flight? You're flying. It's amazing. Everyone on the plane should be going, oh my God, wow, you're flying. You're sitting in a chair in the sky. And he's so right. But that's how we are. Like, you can go to a doctor, they can make this a life-changing diagnosis. And you're like, I had to wait a long time and they didn't take my insurance. And we really have to, I think this is, I guess, across the board, take a breath, stop for a minute. You talk about Stoic philosophy in the book, which I'm really into that lately, which is about just, really realizing what's happening in the moment.
The Louis C.K. thing is hedonic adaptation is the thing, right? We all have that, right? We get used to something so quickly. So in our direct primary care world, we give patients 60 minutes. We get them in within an hour to the practice. And yet some people still complain. Like, have you forgot where you came from? And so I actually did it in the book explaining, listen, there's doctors who are going to do all these incredible things, hopefully, that I recommend in this book, and they're still going to complain because they're getting used to it. And there's ways to now in your newsletter, which you don't have now, hey, I'm glad that the Doctor's Lounge is doing well. We're still stocking it with this to remind people what we're doing for you. And so I did that in my direct primary care practice too, is that I would email after a procedure. I would email saying, hey, I'm glad I can drain that abscess, which would cost $700 at the other office, and I got to save you that money. I'm glad I can help you. We love saving people money. And so I would do that because I know that's how humans are. And listen, we're not perfect. And I get that. And physicians aren't perfect and administrators aren't perfect. And again, this was not a screaming, I hate you administrators. I'm actually literally saying, here's the handbook. And I don't think you'll use it against doctors. Maybe you could, but I think you can do it to keep doctors happier, which makes the environment better, patients happier, and they recruit other doctors and they stay longer. This is not rocket science.
Well, I want to say I love the book. Just to remind everyone, the book is called The Hospital Guide to Physician Retention. And you said you have a website, which is?
Yeah, physicianretention.com.
And I really encourage everybody out there. I think this is great reading for physicians because it really helps really hone in on a lot of the problems, and especially physicians that are looking at moving into administrative type leadership. And of course, I think it should be mandatory reading for all hospital or clinic administrators. If you want to get better outcomes, if you want to make more money, if you want to be more successful, you need to make sure that you can retain the best physician so you can get the best patient care. And I think Dr. Farrago has a lot of great advice, and it sounds like he's going to be available for consulting services as well. I know him personally, and I can assure you that his aim is pure, which is to take care of patients. And to do that, we have to take care of physicians.
Well, Rebecca, thank you. Again, I'm a big fan of you guys. The guts, I've said this before online, I've said this on my blogs, for what you've done for your book, and to the bravery to write that, because I know how bad though that crew comes after you, and I will not go into detail. You guys are the best. You're awesome. I've always said that over and over. I love the book. I want to just thank you for having me on here. And yes, doctors buy this for administrators and hand them the book for a Christmas present. How's that?
I love that. Well, thanks so much, Doug. We hope to have you back another time. So,
okay.
All right. We'll see you on the next podcast.